Hello, welcome again to another series of The World Starts With Me multimedia lessons produced by SchoolNet Uganda on sexual and reproductive health challenges faced by young people. This lesson is going to focus on teenage pregnancy. My name is Namganza Stella, a registered nurse and midwife, and I'm the one going to take you through this session. Teenage pregnancy is a pregnancy that occurs in girls below 20 years. Uganda has the highest rate of teenage pregnancy in the world, with 1 out of every 4 girls aged between 15 to 19 years being pregnant or have ever been pregnant before. Pregnancy can be an exciting thing to both the mother and the family. But it can pose a lot of challenges if the person who's pregnant is a teenager, simply because at this age, they are not yet mature both physically and emotionally. Some of the challenges that can be faced by a teenager who's pregnant are dropping out of school. A teenager may drop out of school simply because when the school realizes you're pregnant, they'll send you outside and you'll give birth, and after giving birth, it may be very hard for you to go back to school, thus shattering your future dreams. Neglect by parents, simply because your parents think you are a disgrace to the family and you've wasted their school fees, so they will neglect you. Denial of pregnancy. Usually, the person who impregnates a teenager will run away for fear of being imprisoned over defilement. Early marriage. In some cases where people are poor and you're a teenager and you're pregnant and they have no way of taking care of you, the parents may end up forcing you into early marriage. Obstructed labor. Now, because a teenager's birth canal is still small, or the pelvis is still small, they can face challenges of obstructed labor because the baby cannot easily pass through the birth canal. Therefore, it will lead to prolonged labor, and this may cause harm to the baby and the mother. 50% of the mothers who die due to complications of pregnancy, labor, and childbirth are teenagers. Unsafe abortions. Usually when teenagers become pregnant, they are overwhelmed and confused about what to do. So they end up making decisions to go for unsafe abortions, which may cause a lot of danger to their health, or even it may lead to loss of life. Economic hardships. Usually teenagers are dependent on their parents and they have no employment. So they also have another person now to take care of. It is overwhelming and it is impossible for them to be able to take care of themselves and their new growing baby. This multimedia lesson on teenage pregnancy is aimed at equipping you with the correct scientific and medical information on what is fertilization, the developmental changes of the baby during pregnancy, the complications of teenage pregnancy, the complications of abortion, and the need to attend antenatal care in case you are pregnant. To help us understand how fertilization takes place, we are going to watch a video on fertilization. As we watch the video, you need to pay particular attention to the following. What is fertilization? What pushes the egg towards the uterus? Where exactly does fertilization take place? How many sperm cells can fertilize a single egg? What is the function of the zona pellucida? And where does the fertilized egg implant itself? Now, let's watch the video.
Fertilization is the epic story of a single sperm facing incredible odds to unite with an egg and form a new human life. It is the story of all of us. During sexual intercourse, about 300 million sperm enter the vagina. Soon afterward, millions of them will either flow out of the vagina or die in its acidic environment. However, many survive because of the protective elements provided in the fluid surrounding them. Next, the sperm must pass through the cervix, an opening into the uterus. Usually, it remains tightly closed, but here the cervix is open for a few days while the woman ovulates. The sperm swim through the cervical mucus, which is thinned to a more watery consistency for easier passage. Once inside the cervix, the sperm continues swimming toward the uterus, though millions will die trying to make it through the mucus. Some sperm remain behind, caught in the folds of the cervix, but they may later continue the journey as a backup to the first group. Inside the uterus, muscular uterine contractions assist the sperm on their journey toward the egg. However, resident cells from the woman's immune system, mistaking the sperm for foreign invaders, destroy thousands more. Next, half the sperm head for the empty fallopian tube, while the other half swim toward the tube containing the unfertilized egg. Now, only a few thousand remain. Inside the fallopian tube, tiny cilia push the egg toward the uterus. To continue, the sperm must surge against this motion to reach the egg. Some sperm get trapped in the cilia and die. During this part of the journey, chemicals in the reproductive tract cause the membranes covering the heads of the sperm to change. As a result, the sperm become hyperactive, swimming harder and faster toward their destination. At long last, the sperm reach the egg. Only a few dozen of the original 300 million sperm remain. The egg is covered with a layer of cells called the corona radiata. The sperm must push through this layer to reach the outer layer of the egg, the zona pellucida. When sperm reach the zona pellucida, they attach to specialized sperm receptors on the surface, which triggers their acrosomes to release digestive enzymes, enabling the sperm to burrow into the layer. Inside the zona pellucida is a narrow, fluid-filled space just outside the egg cell membrane. The first sperm to make contact will fertilize the egg. After a perilous journey and against incredible odds, a single sperm attaches to the egg cell membrane. Within a few minutes, their outer membranes fuse and the egg pulls the sperm inside. This event causes changes in the egg membrane that prevent other sperm from attaching to it. Next, the egg releases chemicals that push other sperm away from the egg and create an impenetrable fertilization membrane. As the reaction spreads outward, the zona pellucida hardens, trapping any sperm unlucky enough to be caught inside. Outside the egg, sperm are no longer able to attach to the zona pellucida. Meanwhile, inside the egg, the tightly packed male genetic material spreads out. A new membrane forms around the genetic material, creating the male pronucleus. Inside, the genetic material reforms into 23 chromosomes. The female genetic material, awakened by the fusion of the sperm with the egg, finishes dividing, resulting in the female pronucleus, which also contains 23 chromosomes. As the male and female pronuclei form, spiderweb-like threads, called microtubules, pull them toward each other. The two sets of chromosomes join together, completing the process of fertilization. At this moment, a unique genetic code arises, instantly determining gender, hair color, eye color, and hundreds of other characteristics. This new single cell, the zygote, is the beginning of a new human being. And now the cilia in the fallopian tube gently sweep the zygote toward the uterus, where he or she will implant in the rich uterine lining, growing and maturing for the next 9 months until ready for birth.
As we've seen from the video, fertilization is when the sperm and the egg meet to form a zygote. Thousands and millions of sperms are deposited in the vagina during ejaculation, but only one is able to fertilize the egg. When the egg is fertilized, it is moved by cilia in the fallopian tube towards the uterus. Once in the uterus, the fertilized egg implants itself, and after implantation, pregnancy begins. After implantation, a hormone called human chorion gonadotrophin, usually called HCG, is produced. And this is the hormone that is detected in blood or urine when we are testing for pregnancy. To help us understand the different stages of development of the baby during pregnancy, we are going to watch a video. As we watch this video, you may need to pay particular attention to the following: the function of the umbilical cord, the development of the different organs and systems, development of different senses, and how the baby passes through the birth canal during childbirth. Now, let's watch the video.
Within a week of conception, your fertilized egg, known as a blastocyst, will make its way to your uterus. The egg is about the size of a pen tip. In days, the cells in the egg arrange themselves into groupings. The inner cell mass will become your baby. The outer cells will become the amniotic sac and placenta. The blastocyst then sheds its protective casing in a process called hatching and burrows into the lush uterine wall. Around week 5, your developing baby is the size of a sesame seed. The cells that once formed the blastocyst's inner cell mass begin organizing and arranging, giving shape to the young embryo and forming primitive organs. Your baby's brain and spinal cord are visible through his translucent skin. Right around this time, your baby's circulatory system also forms, and his heart begins to beat. Your baby looks more like a tiny tadpole than a human. He's drawing nutrients and oxygen through the newly formed placenta and umbilical cord. By week 9, the embryonic tail is gone. Your baby's looking more human every day. With protruding limbs and fingers, a defined nose, mouth, and eyes, and tiny earlobes. Your new resident is about the size of a grape and weighs a fraction of an ounce. It's hard to believe how rapidly one cell evolves in such a short time into the unmistakable body of a baby. At 10 weeks and barely the size of a kumquat, your baby is entering the fetal stage of development. His facial features are defined, and his tooth buds are forming. Over the next weeks, his tissues and organs will rapidly grow and mature. The webbing is gone between his fingers and toes, and his nails and fingerprints are developing. Your baby can open and close his fists and curl his toes. Thanks to his developing muscles and reflexes, he's now moving his limbs and kicking up a storm. If this is your first baby, though, you likely won't feel his flutters until 18 to 20 weeks. Through translucent skin, his vital organs are visible and functioning, including his growing brain, nervous system, intestines, and liver, which is making red blood cells in place of the disappearing yolk sac. The umbilical cord is working hard now. One vein delivers oxygen and nutrient-rich blood to your baby. 2 arteries then carry the blood away. Around week 12, the kidneys have begun producing urine, which your baby will soon start excreting into the amniotic fluid. He'll swallow the fluid and the process will begin again. By week 14, your baby's eyes and ears have moved into place, and he can squint, frown, and grimace. You're now beginning the second trimester of pregnancy, which many women say is when they feel their best. Between 15 and 20 weeks, your baby will more than double in size. As his body grows, his nervous system is rapidly maturing. His nerves are connecting his brain to the rest of his body, traveling from the brain through the brainstem and down the spine, and beginning to extend into his torso and limbs. Your baby's skeleton is changing too. The soft cartilage is starting to harden into bone. This happens first in the arms and legs. Sensory development is picking up speed. Your baby's brain is designating special areas for smell, taste, hearing, vision, and touch. At this stage, your baby may be able to hear your heartbeat and voice. So read aloud or sing a happy tune. Your baby may even be sucking his thumb now. At about 18 weeks, you'll start to experience one of the most exciting parts of pregnancy, feeling your baby's movements. His flexing arms and legs may feel like gentle flutters at first. They'll become even stronger and more frequent in the weeks ahead. At 20 weeks, your baby weighs a little more than 10 ounces and measures about 10 inches from head to heel, about the length of a banana. This week is a big milestone, the halfway point in your pregnancy. Between 21 and 27 weeks, your baby's sense of touch is developing, along with his unique fingerprints. When you rub or gently press on your belly, you may feel your baby squirm or kick in response. He can feel his own face now, as well as anything within his reach, including the umbilical cord. He'll keep experimenting with and refining his sense of touch. Around 23 weeks, your baby can swallow. Soon after, you may notice fetal hiccups. Don't worry, hiccups are a normal part of development, and it's common for your baby to have them several times a day. His lungs are also forming millions of tiny branches called bronchioles. Incredibly, your baby is already practicing breathing by inhaling and moving small amounts of amniotic fluid in and out of his lungs. At 24 weeks, a baby is capable of surviving outside the uterus with significant medical help. At 27 weeks, your baby's eyelids may open as a reflex, but he can't see yet. His lips are formed, and he now has tiny taste buds on his tongue. He weighs nearly 2 pounds and is about 14.5 inches long. Now there's just one more trimester to go. You and your baby are beginning your last trimester together. At 28 weeks, your baby weighs just over 2 pounds. He'll more than triple his weight between now and birth and build a layer of fat that will help keep him warm outside the womb. Your baby's skeleton is hardening. The bones in his head have not yet fused together, which will allow them to slightly overlap as his head passes through the snug space of the birth canal. Billions of neurons have developed and are firing in your baby's brain, creating essential connections that will help him learn in and outside the womb. Your baby can open his eyes now and see the light that filters through your womb. He can hear too, so go ahead and talk or sing to your baby. As your due date nears, your baby will shed small bits of vernix caseosa, the white cheesy substance that covers his entire body and protects his skin from the amniotic fluid he's floating in. Your baby swallows some of these bits, along with other secretions, which pass through his digestive system to become his first bowel movement. At 37 weeks, your baby's skin is pink and soft. He's looking less like a wrinkled alien and more like a baby. He's gaining nearly 1 ounce a day and weighs about 6 pounds. He's now considered full term. In preparation for birth, most babies will turn so their head is facing downward. Your baby will stay that way, head resting in your pelvic area, as he gets ready to greet the world. In the weeks before birth, your body slows down production of the hormone progesterone while increasing production of other hormones, including prostaglandins, which soften the cervix, and oxytocin, which triggers the uterine muscles to contract. True labor contractions are rhythmic and painful and grow consistently stronger. As the long vertical muscle bands of the uterus tighten, they pull the cervix open. The strong muscles at the top of the uterus push down and release, guiding your baby toward the cervix. The mucus plug, a collection of thickened cervical mucus that sealed your cervix shut for 9 months, may be expelled days before or in the midst of labor. When the amniotic sac ruptures, your water has broken. It can feel like a trickle or a gush of fluid. Your cervix will begin opening and thinning, known as dilation and effacement. Once you reach about 4 centimeters, your body will move into active labor. In active labor, contractions become stronger and closer together. At 8 centimeters, you enter what many consider the most painful part of labor, transition. By 10 centimeters, you're fully dilated and may feel the urge to push. This is your signal that the second stage of labor has begun. Your baby will move down with each contraction. The 3 separate soft bones of his head will temporarily overlap so he can pass through the snug birth canal. Your baby's scalp will come into view. When the widest part of his head is visible, your baby is crowning. With several more pushes, your baby's face, shoulders, and body will emerge. In the third and final stage of labor, your placenta detaches and is expelled. With your baby's first breath, the incredible journey of birth is complete.
As you've seen from the video, having another life grow inside you is beautiful, but only when it is the right time. The right time is when your body is fully mature and your birth canal is wide enough to allow your baby pass through during childbirth. With the right person, a person who's going to support you and provide for you when you're pregnant and after the pregnancy. Under the right circumstances, you should not be forced into sex, raped or defiled in order to give birth. reasons. You should not give back as a means of paying back for the gifts your boyfriend has been giving you, or because you fear to be dumped. Because even after being pregnant, you can also be dumped. During pregnancy, you need certain nutrients for the proper growth, development, and health of you and your baby. Calcium is one of the nutrients that are needed during pregnancy. Calcium is essential for the growth of the bones of your baby. The baby draws calcium from your bones. So during pregnancy, you need to increase on your intake of calcium. Calcium is found in dairy products like yogurt and normal milk. It's also found in green leafy vegetables and in mukene or the small fish. Calcium is also found in red meat and eggshells. The other nutrient that is needed is vitamin C. Vitamin C is essential to boost your immunity and the immunity of your baby. Vitamin C is found in foods like the citrus fruits, that is oranges, lemons, pineapples, and it is also found in passion fruits. Vitamin C can also be found in pawpaws and green leafy vegetables like nakati and dodo. Folic acid. Folic acid is essential for the formation of vital body organs like the brain and the spinal cord for the baby during pregnancy. Once a mother does not take folic acid during pregnancy, it poses danger to the baby. The baby may get a condition called spina bifida. Spina bifida is a condition whereby the spinal cord of the baby comes out from the back. Spina bifida can also be caused when a mother takes alcohol during pregnancy, because alcohol inhibits the absorption of folic acid in the body. Some of the foods that contain folic acid are sweet bananas, avocado, green leafy vegetables, cereals, legumes, nuts, and roasted soya beans. The other essential nutrient during pregnancy is iron. Iron is a very essential nutrient during pregnancy, simply because iron is responsible for the formation of red blood cells. During pregnancy, a mother shares her red blood cells with the baby. So she's at risk of getting anemia because she's sharing what she has with another life that is growing inside her. Therefore, it is very important for a pregnant mother to eat foods that contain iron. Some of the foods that contain iron are meat, chicken, beef, groundnuts, eggs, fish, liver, kidney, among many others. Another nutrient that is needed during pregnancy is vitamin A. Vitamin A is essential for the development of the bones of the baby. Vitamin A is found in yellow-colored foods like pumpkins, mangoes, jackfruits, and carrots. Then we have iodine. Iodine is very important in the development of the brain of the baby. Iodine is found in iodized salt. It is important for pregnant mothers to take iodized salt during pregnancy. Unsafe abortion is the termination of a pregnancy before 28 weeks of gestation by using radical methods and untrained medical personnel. Use of improper and unhygienic instruments to evacuate the growing baby. Use of herbs, breaking the amniotic sac. Use of caustics like jig or bleach to evacuate the growing baby, and use of larger doses of drugs. Some of the immediate complications of abortions are excessive bleeding. Excessive bleeding occurs because usually unsafe abortions end in incomplete abortion. Therefore, the uterus cannot easily contract to stop bleeding. Infection. As earlier said, use of dirty instruments can lead to infection. Infection can lead to sepsis, and sepsis can lead to shock. Damage of internal organs. Because people use untrained medical personnel, they lack technique. So they may end up piercing the uterus and even the intestines. This poses danger, and many other diseases can occur. And fistula. Fistula can occur because of lack of technique or use of the wrong instruments, therefore creating a hole between two organs. This can be creation of a hole between the vagina and the rectum, or between the vagina and the bladder. Unsafe abortions can also lead to death. Now, let's look at the long-term consequences or complications of unsafe abortion. Incompetent cervix. Because of the poor technique of the people who carry out unsafe abortions, they end up weakening the cervix. And what happens is, during the consequent pregnancies, you may not be able to carry the baby till like 5 months. So what will happen is that your baby will get aborted usually at around 3 months because the cervix is too weak to carry the baby. Infertility. Because of the scarring around the uterine lining, it may be difficult to become pregnant again because the fertilized egg will not be able to find a suitable ground to implant itself, since the whole of the uterus can be full of scars. Ectopic pregnancies. Still, because of lack of a place or area for the fertilized egg to implant itself, you may end up having ectopic pregnancies, which are pregnancies that happen in places that they are not supposed to happen. Disability. Because of the complications of infection to the other organs in the body, one may end up becoming disabled. Now, let's talk about the complications of teenage pregnancy and childbirth. Anemia. Teenage mothers are most likely to suffer anemia due to poor nutrition. Anemia Anemia is a condition characterized by reduced numbers of red blood cells or hemoglobin, a pigment which is essential for carrying oxygen throughout the body. Obstructed labor. This is when a baby's head fails to pass through the birth canal. The reason as to why the baby's head fails to pass through the birth canal is that a teenage mother's pelvis is not yet fully developed. And because it is small, the baby's head will try to pass through but will fail. And that is what they call obstructed labor. Obstetric fistula. Obstetric fistula comes as a result of prolonged labor, and prolonged labor comes as a result of obstructed labor. When there is prolonged labor, there is a continuous pressure on the walls of the vagina by the head of the baby. This continuous pressure may cause a hole to develop between the vagina and the rectum, or between the vagina and the bladder. Fistula may lead to urine coming through the vagina or feces coming out through the vagina. Fistula is a very devastating complication. Postpartum depression. Because this teenager has given birth, she's overwhelmed by the responsibility of taking care of this baby. So the teenager may end up having psychiatric conditions like postpartum depression, where she has a very low mood for such a long time. And these are some of the reasons as to why mothers throw away babies in dustbins and toilets. Fetal distress. Again, because of the prolonged labor, which is as a result of obstructed labor, the baby may lack oxygen or may get tired on the way because the journey has been made so long. So when the baby comes out, she or he might die, or else it may be hard to bring it back to life. In case you find out you're pregnant, you may need to do the following. Accept the pregnancy. Do not think of carrying out an unsafe abortion, for it may lead you into death or disabilities or even infertility. You can still go back to school after giving birth. Disclose it to your parents. Tell your parents that you are pregnant. It may be very difficult to disclose to the parents, but you need their care and support, both for the good of your health and your baby. You may need a counselor or an elderly person to help you in the process of disclosing to your parents. Inform the boy or man who is responsible for the pregnancy. In some cases, he may deny, but it's very important that you play your part. It is important to tell your man about the pregnancy because you need his care and support both during the pregnancy and after delivery. Attend antenatal care at least 4 times during the pregnancy so that you can be helped in one way or the other, as we shall see ahead. Deliver from a healthy center where there is a midwife or a doctor in order to be helped in case any complication comes up during the process of delivery. Attend postnatal clinic so that your baby can be immunized and therefore healthy. Antenatal care is the care given to a pregnant mother by a midwife in order to treat or prevent the healthy problems that may cause danger to the baby or the mother. A pregnant mother is supposed to at least attend antenatal 4 times during pregnancy. During During antenatal care, the following is done. Assessing the health of the mother and the development of the baby in the womb. Nutrition education. During antenatal, you are taught what type of food to eat at what stage of pregnancy and what that food is going to do to you and your baby. HIV testing and counseling. During antenatal, mothers are encouraged to test for HIV and it's free. Supply of food supplements like iron and folic acid. Iron and folic acid that are found in food may not be sufficient during pregnancy. So during antenatal care, mothers are given iron and folic acid to supplement on the food they eat. A pelvic examination is done for the midwife to ascertain whether the mother is able to produce by spontaneous vaginal delivery or by cesarean section, and the mother is prepared for anything. Treatment of other STIs like syphilis, gonorrhea, candidiasis, and urinary tract infections. A mother can also be treated for other diseases that occur during pregnancy. Health education on good hygiene, prevention of malaria, labor and what to expect in labor, and newborn care. Again, that brings us to the end of the lesson of teenage pregnancy. You are encouraged to watch the multimedia lessons on menstruation and its management and contraception.